Hello, dear students. I welcome you all for the session Drugs in Clinical Toxicity, Part 2. In previous part was discussed the definition and classification of poison, and in this session we are going to discuss the general steps or principles employed for the treatment of poisoning. General steps in the treatment of poisoning, this we are going to discuss. So, first step for the treatment of poisoning is identify the cause of poison. So, this is very necessary that we have to identify the cause of poison from the parents of the patient or from the patient himself or herself. Then step 2, preventing the further absorption of poison. Then step 3, hastening the elimination of poison. Hastening of elimination of poison means increasing the elimination of poison. Then fourth, uses of antidote. Then fifth step, general supportive measures for improving the condition of patient. And sixth step is monitoring of the patient after the episode of poisoning is over. There is a chances that rebound effect may be produced by the poisons after its treatment. So that's why the patient must have to monitor for a certain period of time after the episode of poisoning is over. So this step we'll discuss in brief. So first step, identify the cause of poison. So this is the first step of the treatment is to identify the poisons. In this step we have to identify the poison, by which poisoning takes place. And the cause of poison can be known from the relatives of the patient or by the parents of the patient or himself or herself if the patient is conscious. This step helps in deciding the specific treatment to the poisoning. If we know the cause of poison or by which poison the poisoning takes place, then this is very easy to treat the patient or to treat the poisoning. Then second, step 2, preventing the further absorption of a poison. So this is important step in controlling the further spread or the absorption of poison in the body. General rule includes induction of vomiting. By inducing the vomiting, we can prevent the further absorption. So for that we can administer the syrup of ipecac. This is preferred emetic for inducing the vomiting. Dose of ipecac syrup is 15 ml for children less than 6 months and 30 ml for the adults. But this emesis is contraindicated in the certain cases, such as vomiting should not be induced in a comatose patient. If we induce, then there is a chances that the content from the gastrointestinal tract may block the respiratory system. Then emesis is contraindicated in a caustic poisoning and in the petroleum distillate poisoning or the aromatic substances in which the emesis is contraindicated. If the emesis is induced in those patients who are consume the caustic poisons or the corrosives, then the esophagus may be burned, ulceration may be takes place, and due to the aromatic compound there is a chances for the problem in the respiration. The emetics should also be not given to those where is a risk for the convulsions in the patient. In these peoples, again, the omitting is contraindicated. Then second, gastric lavage. Gastric lavage is an important measure to control a poisoning when it occurs due to some aromatic substances such as perfumes. It is also helpful when the emesis is contraindicated. Then third is use of activated charcoal. This is the mechanical antidote. Activated charcoal adsorbs the poisons and delays the gastrointestinal absorption of the poison. It is helpful in the treatment of poisoning from the aromatic and alkaloid poisoning or the alkaloidal compounds poisoning. Then third step, that is the hastening the elimination of poisons. This is also an important aspect in treating the poisoning. Following general rules are applied for the increasing the elimination of poisons from the body. First, altering the pH of urine. In poisoning from basic substances such as the amphetamine or the quinine, urine of the patient should be made acidic to hasten the elimination of these substances. Basic substances and their elimination is increases in the acidic pH of urine, and vice versa, means if the pH means if acidic substances poisoning takes place, their rate of elimination is increased by making the urine alkaline. Then second step, dialysis. Peritoneal dialysis is very much popular nowadays and used in the treatment of methanol poisoning and in a snake bite. Hemodialysis is more superior technique but requires highly sophisticated unit for care. Peritoneal dialysis and hemodialysis have limited use in the treatment of intoxication with the chemicals. Then catharetics. Catharetics are used to hasten the removal of toxic substances and are used in the ingestion of hydrocarbons and enteric coated tablets. Sodium sulfate is frequently used catharetics. Catharetics are the agent or the compound which are increases the evacuation of bowel. Then step number 4, use of antidote. There are certain specific antidotes for treating the specific cases of poisoning. Here is the list of some commonly employed antidote for the treatment of certain poisoning. So first of all, we discuss about the atropine. Atropine, it is used in the treatment of organophosphorus poisoning. In suicidal attempts in India due to these substances is highest. So that's why for the organophosphorus poisoning we use the atropine. The next, calcium editate is used in the lead poisoning. Calcium editate, this is the chelating agent and this is used in the lead poisoning. Ethyl alcohol is used in the methanol poisoning. Dimercaprol is used in a heavy metal poisoning such as the arsenic, copper, lead, gold and the mercury. Dimercaprol is used in a heavy metal poisoning such as arsenic, copper, lead, gold and the mercury. Oxygen gas is used to treat in carbon monoxide poisoning. Penicillamine is an antidote for heavy metal like a copper, lead, mercury and zinc. Pralidoxime, it is used in a organophosphorus poisoning. Then milk is also a universal antidote. Its antidote property is attributed to calcium and magnesium present in it, which act as an chelating agents. So this is all about the uses of antidote for the treatment of poisoning. Now we'll discuss step number 5. This is the general supportive measures for improving the condition. General supportive measures are meant to ensure the well-being of the patient and for the fast recovery from the poisoning. General measures includes use of oxygen therapy when there is a hypoxia or the probability of some same in the patient, correction of blood pressure of the patient by fluid therapy. Dopamine may be required for correcting the blood pressure. If there is a cardiac arrhythmia in the patient, then safety measures should be taken under the supervision of the expert. If there is a correction of plasma is needed, correction of plasma biochemistry like acidosis or the alkalosis in the blood, then airways should be cleared with the help of suction apparatus. So these general supportive measures we apply for improving the condition of the patient. That we use the oxygen for the hypoxia, then correction of blood pressure, correction of plasma biochemistry if acidosis or the alkalosis may cause, then airways should be clear with the help of suction apparatus. And the last step is monitoring of the patient. After the patient is recovered from the adverse effect, it is important to monitor the patient for some time. This step is necessary and performed to ensure that there are no other complications in the case. After ensuring the patient is fully recovered, he is allowed to go home. And then there is again chances that rebound effect may be produced by the poisons. So due to that reason, patients are kept in monitoring for a certain period of time after they are recovered from the condition or from the poisoning. Okay, so these are some of the general steps in treatment of poisoning, and this question generally asked in the exam. So students, if you have, there is some summary. General step involved in the treatment of poisoning. These are identify the cause of poison, preventing the further absorption of poison. Third is hastening the elimination of poison, then uses of antidotes. General supportive measures for improving the condition of patient, and last step is monitoring of the patient after the episode of poisoning is over. So if you have any queries, you can ask me on my email ID, or you can ask the questions on our WhatsApp group, or you can call me. So feel free to ask the questions. Thank you. Thank you very much for your patience listening.